Well, good evening, everybody, and I want to welcome you to this special program by the Brain Injury Association of New York State. How many concussions are too many? And good evening, I'm Benita Zahn, and we're going to switch to our next slide. There we go. And many of you know me from News Channel 13. I now am a health and wellness coach with Capital Cardiology. I'm still doing a program at News Channel 13 called Health Beat. So this is still my area that I love working in, and we've got a fabulous panel for you tonight with a very important topic. Our panelists tonight include Amy Brunell. She's the athletic trainer at South Colony Central School. Amy, welcome. Also, Harry Carson, former NFL New York Giant, Football Hall of Famer, and concussion advocate. Harry, thank you for being with us. Shay Data, a doctor at NYU Langone Hospital on Long Island, who specializes in brain injury and concussion. So good to have you with us, Dr. Data. And Zach Hamilton, a former NCAA D1 hockey goalie at Colgate. He's with the Headway Foundation, concussion awareness advocate, and a medical student, and he's also endured concussion. So welcome to all of you. Everybody, thanks so much for being here. Yes, we will take questions from the audience. You'll be able to do that via the chat on the bottom of your screen, and some of you have already provided questions. We'll get to them. But I want to start by asking, let's just do, I guess, a little sort of groundwork here. And Dr. Data, what's the working definition of a concussion? Because let me just say, concussion it's a brain injury, and it's caused by an impact to the head, either from a blow or violent shaking. And when it happens in sports, it's much more than just having your bell rung. It's not something, we hear them say, oh, just tough it out, shrugged off. In fact, repeated concussions can lead to long-term health issues, including changes in cognitive status. So how many concussions are too many? What are the symptoms? How is the head trauma treated? We're going to get to all of that. So Dr. Data, let's start with that working definition of a concussion.
Thanks so much. I would love to basically go over just a very basic definition. You said it very beautifully. It's a type of traumatic brain injury. We call it MTBI, or mild traumatic brain injury, which is caused by a bump, blow, jolt, shaking, or a hit to the body that causes the head and brain to move rapidly back and forth, sort of with the neck snapping. And that's also known as a contre-coup injury in French, where the brain goes back and forth inside the skull. And this rapid movement usually causes the brain tissue to change shape, or it can stretch and damage the brain cells. So the odd part is this damage also can cause cellular changes at the cellular tissue level, right? It causes chemical and metabolic changes within the brain cells, making it difficult for the cells to function and communicate. And since the brain is the body's control center, this effects of the concussion can be far-reaching. And we'll discuss how it can affect everything from your mood to pain, right? Headaches, let's say, concentration, memory, and even balance, as well as ocular and vestibular function.
And the symptoms can be different, and they may not present right away. Isn't that true?
That's absolutely correct. Sometimes if it's someone's first injury, depending on, and everybody is different, right? They're, as we had discussed before, sort of like a thumbprint. It all depends on how strong the force of the blow was. Was this their first? Was this their second? Sex matters, male versus female, the type of sport that they're playing, and baseline functioning. Are they a high functioning individual? Did they have at baseline mood issues before? Are they on medication for migraines? What is their family history when it comes to neurologic disease underlying? So everyone is different. It's very hard to kind of predict and kind of stratify this type of injury. So we obviously, as physicians, take it on a case-by-case basis.
So much to cover here. Harry, as an NFL player, I'm sure that you've endured your share of concussions. And we talked a little bit before the official program started. Do you even have a count as to how many you endured?
Well, I can tell you this. I never really kept track of how many concussions I sustained, but the one that I probably remember more than any other time was my first day of football practice, being thrown into one-on-one drills and blocking and tackling. And um, the guy, I was a freshman, and the guy who I was squaring off against in practice was a junior. He was bigger than me. Um, and when the ball snapped and he fired off the line and hit me in the head. And, you know, it was like being a dog being mauled. And he blocked me. And after, you know, hitting me in the face, and when the play was over, the only thing that I could see was stars twinkling before my eyes. And it's one of those things that I had never really experienced it before. And, you know, you hear coaches say, you know, shake it off. It's no big deal. Here's some smelling sauce or ammonia capsules, and they put it under your nose, and, you know, it's pretty strong. So that's the one that I remember more than any other concussion. But when you look at me as a former athlete on the NFL level, you can't just look at me as a football player for the New York Giants. You have to look at me as a guy who played 4 years of college, and you had strong practices during the course of football season. And then you have, you know, guys who, or players who are in high school. And, you know, that first hit that I took in high school caused me, or was a contributing factor for me to walk off the field, because I realized at that point that I had no business being there, feeling what I felt. And when I quit the team on the very first day of practice, I wound up going and running into guys who were playing boys club football. And I was able to sort of ease my way into playing boys club football. And I was able to make the transition the next year going back to play. But you're looking at 21 years of football. And being a player who was a very physical player, there were a lot of hits that I gave out, and there were a lot that I sustained.
But you know, Harry, I've got to jump in for a second and really give you kudos, because that first hit when you were in high school, very little compared to today was known about the effect of those hits.
Actually, there was nothing.
Right.
There was nothing that anyone had on concussions. I mean, it was really a part of the game. And if you could not deal with concussions, then you probably shouldn't play football. And that is the way it was.
And that was then. So now we move to Zach, who is a couple of years younger than you, and he's playing hockey. And when you endured your concussions, how much different was it than what Harry was talking about?
Absolutely. I think the culture is a little bit different than when Harry was playing. Certainly, the first concussion I had, the most severe one I had while I was in college, was a little bit atypical to Dr. Datta's point, where things can present a little differently, where I didn't have symptoms in the first few days. But when I eventually did develop enough symptoms to the point where I really felt that there's something wrong, I immediately entered the concussion protocol that we had at Colgate. And so I saw our physician, I worked with our trainer, I was pulled out of practice, and I went through our 5-stepwise process to return to play. And so right away, the culture was different. But I think we still have ways to go, because at the time, given the atypical presentation of my concussion, I ended up staying in class because I was really given the option. And I was in some of the more challenging classes of my program, and really didn't want to miss anything. And staying in school during that time and pushing my brain that way really extended my symptoms for months, and really sort of accentuated the severity of my concussion.
Yeah. So we heard Harry's experience and yours, Zach. Amy, let me bring you into the conversation, and something that Harry said also to me is just so important, a little tangential to this. You may still have parents to this day who are encouraging their kids to stay in the game, even when they take that hit, because, you could be going to college on a scholarship. Well, Harry took himself out of the game. He still became a pro. So how do you now morph this conversation to the parents that we're not talking about bell ringing? We're talking about a potentially life-changing situation. And the topic tonight is, how many are too many? And for some, it may just be that one is really the answer here. So share with us how you're educating parents.
Well, the education begins with, as Dr. Data mentioned, it's a mild traumatic brain injury, but there's nothing mild about it. When you have brain trauma, you have brain trauma. You have issues not only with the physicality of the sport, but also the cognitive classroom effects. Their personalities can change, whether they're more tired, more emotional, and we look at the whole picture. We just don't look at whether or not they have a headache, which is the most common sign of and symptom of a concussion that we have. So I really try to promote with the parent and the child themselves that this is a long-term thing we're looking at. They might be out for this Friday night football game or whatever event that's coming up soon, but we need to look at the long-term brain health. And this, if we get them back the proper way through the proper channels, the more successful season they'll have for the rest of that particular sport season, but academically, and then throughout the rest of their high school career. Hopefully they move on to college, or, and as in Harry's case, onto the pros. But we know most of our high school athletes won't make it that far. So we have to look at their long-term health, not just here and now making it to this Friday night football game or whatever, again, whatever event's up next, but at the overall picture of what we want that student athlete to be in a few days, a few months, or even a few years.
Is it safe to say, Dr. Jada, that one may be too many in some cases?
Absolutely. It's almost very surprising sometimes as a clinician. You see someone who's just gotten one hit, let's say in a car accident, or got hit from behind, versus another athlete that I'll see over many years of being in the NFL and does not seem as bad as this one person whose life has been altered after the one blow, let's say. So I just think that to kind of quantify, it's very difficult. Is it one? Is it two? Is it three? Is it four? Is it half, right? Some people slip and fall backwards and hit their head and they're never the same again. So it is very, very hard for us to tell whether or not one blow versus two versus four. It's all in the mechanics, as well as the person who's receiving the blow or the injury, how their body is actually reacting at the cellular level ultimately.
You mentioned something about sex can play a role, and why does one raise the risk for another? And let me just ask, one of the viewers had asked, and if this is for you, Zach, how did your concussion impact your playing career, and was it the first one that you had sustained?
Yeah, it's a good question. So it was the second one that I'd sustained, but it was certainly the most severe. It was my sophomore year, and it took me out for the rest of the season. And so as I know, this sort of milder or more atypical presentation, there wasn't really a one hit that kind of triggered me and others to sort of really take it more to the face that it was a concussion. So it took me out for the rest of the season. It affected my schooling for the rest of that year. And I really didn't turn the corner on my recovery until I had spoken to my school physician about some of the mood disorders I was having related to, or mood symptoms I was having related to my injury, and doing some vestibular and ocular training in the summer, so to be able to return in the fall. But I really think it was around 6 months or more that it took for me to really feel like myself again.
A substantial amount of time.
Mhm.
One of the other participants is asking, how can I stress to others that concussion recovery must be ensured for optimum brain health? Prevention of concussion has been my objective since '92 when at the University of Arkansas. So how may I aid? So yeah, let's talk about the recovery also that goes into it, which I think you started to touch on, Amy. You can't rush somebody back.
No, I mean, it's New York state law has addressed the public high school return to play protocol. And it's a 6-day recovery process from being asymptomatic to being back in day 6 being the game day. But that comes after everything else. That comes after the academics and and all the other symptoms have disappeared or recovered, I should say, and the students back in fully academically to the place they were before. Most of our mild traumatic brain injuries, these concussions, will resolve within a couple of weeks or a month. There's some that go on further, like Zach's experience, and I'm sure Dr. Data has had plenty of patience with that as well.
Yeah. Another viewer is asking for the athletes after sustaining multiple concussions, and this would be you, Harry. How many did it take before you feel your brain returned to normal?
Well, I tell you what, after that first concussion, I really didn't think about it. I just kind of moved on. And, I may have been going through certain issues at that time, but I did not equate it to getting hit on the football field. I just sort of went on, just living life. And, just keep in mind that back during that era, and I hate to say it because it sort of gives away my age, that was a normal part of playing football. You got dinged and you had to shake it off. And, if you couldn't go back out and play, then they put somebody else in. So,
But Harry, there are a lot of parents out there, and maybe even grandparents who are very involved in raising kids who still have that attitude.
yeah, yeah, because they played.
Amy's smiling.
She
deals with it. Yeah.
They played a long time ago, and they're going off of their own past experiences. Everybody, if you're a parent, if you are a grandparent or even a great grandparent, you probably grew up with, Friday night football or Saturday afternoon football, and it became sort of a staple of a part of you growing up, and you want your grandson or granddaughter or whoever to participate. And, it's part of living and, growing and having good experiences of, just living. But quite frankly, so much more information is out there now regarding the effects of long-term effects of concussions and traumatic brain injury that parents and grandparents should know, and they should educate themselves about the risk that they are assuming when they sign their kids up to play.
And I see Dr. Data nodding in agreement with you there. And Amy, and we addressed this. Somebody asked, so do you find, how do you define too many concussions versus too many head injuries? They're really the same thing, aren't they?
I think I just want to echo a sentiment by Harry, which is very important, which is knowing about this, because of course, right? Let's break down brain injuries, let's say in the sports level. It's very high pressure, even at the high school level, to perform well because academics and perhaps scholarships are tied to it. And then when you get to the college level, then you get to the pro level, right? Your living is dependent on it, as well as your whole family depends on your income, let's say. But you have to think long term. If you don't have like your wits about you and your mood is always up and down, and let's say you can't think straight and you're at a point where your memory is just not there, is it worth it in the long term for you to continue a career that could potentially mean that your health suffers or your mental health suffers or physical health suffers down the line? So it's sort of conceptual. Most people think, oh, this is not going to happen to me, like you're just fear mongering or whatever. But we really want to put things in place to protect our youth and protect the future athletes of this country, because it's about protection. It's not about kind of fear mongering. Of course, we don't know, right? Some people that I've seen, and I've seen, you know, a lot of professional players all the way to Olympic athletes that have just hit their head as swimmers on the side of a pool, just turning. And it's taking them 6 months to a year to recover. So it's a real thing, right? Our brain is very soft. There's a hard case supposedly protecting it, but there are a lot of other forces at play. And so I really think that now that we have more awareness, it is difficult, right, to deal with the tiger moms or the tiger dads who really want their children to be successful in sports, but we also have to keep in mind that their brain and their body is paramount, and really we want to protect that in the long run, right? Because that's what we call intellectual property. There's no price tag on it, correct?
And Amy, you raised your hand. You wanted to jump right in there. Go ahead.
I did. There's been so many points here I can unpack from both Dr. Data and from Harry. I mean, one of the first things he said is about how he lined up against another larger player his first year. And, you know, in terms of the spectrum of what we see from parents and grandparents, from those that want their experience to be just like their grandkids and kids' experience, to the ones that are afraid. And I think that's the one we have to address as well here. Parents who are nervous about their children playing football. That's what we tend to talk about a lot. But any sport, I've had athletes, swimmers, cross-country runners, all experience concussions. It's not just football. What I did want to bring up with football, though, is that there are rules in place now. You can't have those contact collision during the first few days of practice. So the first few days are non-contact, and then it gradually increase and transitions to full contact. But, you know, I have a great school district I work with. My coaches are wonderful. I couldn't ask for a better set of coaches. And we have, you know, tackling rings, tackling dummies. We do as much as we can to practice that skill development first before they actually start full contact live practices. So, you know, for the parents that are on the other end of the spectrum that are nervous about their their children playing contact and collision sports, you know, be aware it's not just football, it's across the whole spectrum. Accidents happen. And, you know, our coaches involved in things like football, ice hockey, that's another one that has a lot of protective equipment and collisions, lacrosse. There's a lot of awareness and understanding that they need to prevent is the key to these concussions.
Yeah. One of the participants, one of the viewers now says they've experienced 4 TBIs from car crashes. Does that make that person more vulnerable to dementia? Thank you for your question. And I think we've lost Dr. Data for a couple of moments, so we're going to hope to get her back in here, you know, technology being what it is. But Amy, I think you can probably talk to that a little bit. And also, why does one concussion raise your risk for a second concussion, even if you're now being careful?
Well, I think what we hear a lot about is the threshold for everybody, and everybody's threshold's a little bit different. You can get hit on the head with the same force in the same spot and the same experience as somebody else. You know, I just personally, I think I have a very low threshold. In high school soccer, I switched from being a defensive player because I'd get headaches just from heading the ball, even with the proper mechanics. I switched to goalie. I actually did very well there, so it worked out for me. But I think we talk about thresholds, and whether or not maybe Dr. Dowd, if she gets back on, can attest to it. Does the threshold change after we've had multiple concussions? You know, do we get more susceptible to having further ones?
And we've seen Dr. Data. Does the threshold drop for getting a successive concussion?
Yes, I think what was being talked about is there's concussions and then there's subconcussive hits. The subconcussive hits after the first one, each time, let's say you have one hit, then you recover well and you go back. You're probably stronger to recover from that subsequent hit, let's say. But if you don't recover enough, then you have these subconcussive hits. Even smaller hits will put you out longer. And even, let's say it's not just sports. I see this in a lot of, since we're a New York Brain Injury Alliance, New Yorkers, very type A, right? What, I have to be out from work for 2 months? Are you kidding me? Or 1 month or 2 weeks, they will not listen to my recommendations, okay? Then call the office, 5-alarm fire on a Friday night. I've had a headache for straight 2 weeks. I've been whatever. Then, you know, in discussion, you find out they haven't taken time out for work. They're still doing screen time. They're still doing their normal activities and pushing themselves to the brink so that their brain is not getting the time to have the proper rest. And it's
Dr. Dana, I've got to jump in for a sec because I've read some conflicting stuff, and I'm sure the participants also. The amount of time we should stay out of school, and whether it should be in a darkened room, and before you start to participate, that research has raised some questions and changed some recommendations.
Yeah, that's a great question. I was going to get to it, and I'm sure everybody else here knows about the newer guidelines where you do not just the recommendation is not for you to cocoon yourself and be in a dark room the whole time. The recommendation is graded return to work or graded return to play under a supervision of a professional, right? And also it means that you get treated appropriately and then expose yourself in small increments to the point where you're not setting off your symptoms and setting yourself backwards again. So most people don't do that. They just keep going full force and are like, why can't I do this? I can't remember anything. And just to add, like, it's not just rest. You see physicians that are trained in brain trauma, like myself and my colleagues that know the proper medications, as well as I use a vitamin protocol and things of that nature, as well as we mentioned vestibular PT and physical therapy, and then working with, the athletic coaches to get you back on the sidelines in a organized fashion, not in a fashion that's rushed. And that's basically what we need to do. Is everything perfect? No, but at least we have safeguards and guidelines in place in order for us to do that in a supervised manner.
And the patience is a big part of it. You talked about that. One of our viewers, one of the participants also messaged about that. You've got to be patient. Zach, you know that. You were probably chomping at the bit to get back in the game, saying, well, hey, coach, I feel good, put me in. And I'm sure Harry was the same way.
Absolutely. And patience, rushing is a word that Dr. Data used. The pressure to get back to play, whether that's pressure you put on yourself, whether that's pressure you feel from your teammates or your coaches or your parents, if you're a little younger. I think one thing that I have the advantage of now looking back on my career is that window of opportunity where you're putting pressure on yourself, where if I miss these 3 games this month, this couple stretch of months, it's over. That window of opportunity is so much larger than a couple of games, a couple of months for your career, whether that is to be going to college or whether that is to be playing professionally. Where there's a will, there's a way. And I've seen that in some of my peers who've had setbacks due to concussion. And so it's a hard perspective to take as an athlete or as a parent to see the forest from the trees with regard to that. But certainly looking back on my career now, I can see, those small windows where I may have missed something where it was not the end of the world.
It's hard when we're kids, especially.
Mm-hmm.
It all seems, one of the participants is asking, have more football programs started any baseline testing? I know as a physical therapist, this helps treat an athlete if they have baseline testing to get them back to their baseline. Amy, probably that's for you.
Yeah, well, New York State has a Concussion Management Awareness Act of 2012 as updated in 2018, and it does require baseline neurocognitive testing. We use impact testing across New York State. There's other different types of baseline testing as well. And we do that with not only football, but all our collision contact sports, including our pole vaulters, our high jumpers, our sprinters, and then of course, our baseball, softball, lacrosse, and all those other type of contact sports.
So it is going on there. And I have another interesting question. One of the viewers tonight writes that they were hit by a car back in May as a pedestrian, and the back of their head hit the concrete. They had pain, a bad bump, but they didn't sustain, they say, a brain injury or concussion, thank the good Lord. They were seen in the emergency room. Is that unusual, they asked, that they suffered no serious injury?
Again, as we said, everybody's different, right? It's like a snowflake. So it really depends on how hard you were hit, how you broke your fall. Was there loss of consciousness? Were you awake the whole time? Was there neck injury? It's not just head injury. We should also think about there's a lot of cervicalgia, cervical neck injury that contributes to, let's say, concussion-like symptoms. And these things to be protracted. Okay, the brain and spine are connected. So it's not uncommon, but consider yourself very, very lucky, and we're happy that that did not happen to you. It is a little bit kind of, almost a miracle that nothing happened after you struck the concrete like that. So
Another one of the questions from the viewers is, can a concussion affect your vision, and how? And I think Dr. Data, you started indicating, talking about that, and you too, Amy. And do you recommend the neurologist have an imagery done to them when there were persistent headaches or seizures, such as an MR or a CAT or a PET scan?
So that definitely is something that is based on the neurologic exam. So if there's focality, if there is misalignment of the eyes after we do the testing, certainly we will send imaging. But I will tell you, I may not have been practicing for as long as a lot of other neurologists out there, but in the time that I've been in training and practice, I've had 99% of my brain scans come back normal. So most of the time, brain scans are normal, except for if you go to the ER and they do a CAT scan and they might find, let's say, blood, right? At that point, it's not MTBI anymore, it's a traumatic brain injury with a closed head bleed. So you have to understand, MRI is sensitive. Sometimes it can pick up stretching or bleeding of the nerves when they're stretching in certain sequences, but that's like very rarely, very rarely. But still, the patients are symptomatic. They look bad. They look very bad, even though the MRI CT scan is normal. This is why someone who's trained in this is the one better person to see these patients, because a lot of times doctors will go, "Oh, you're okay, like your scans are normal, like all your blood tests are normal. I don't know what to tell you."
You had a concussion, you got problems, right? That's sort of the groundwork, and then we go from there. Amy, I know you want in.
Well, it goes back to the concussions we have in sport. I actually do not recommend that a parent bring their child to the ER that night if they are stable. If they're experiencing a headache and some dizziness, bring them home, let them rest. Because if they spend time in a noisy environment of the ER, they're not in acute, not acute issue. Right now with COVID, they're going to be spending hours in the ER, and they're not going to be home resting where their recovery can start. And that's because, just like Dr. Data said, 99% are normal. So they're not going to really find anything. Now, if they're decompensating and there's other things going on, obviously bring them to the ER. But right now, the care isn't take them away from the game and bring them to the ER. It's take them away from the game and let them go home and rest.
Yeah. And, we were talking a little earlier before we got formal here about how coaches have been and have to be concussion certified now, Amy. What's going on in terms of the coaching staffs?
The coaches have to take a CDC heads up certificate program every 2 years. And this teaches what to look for in terms of, what a concussion looks like, how it happens, and how they're to care for it. Colony High School has hired the athletic trainer, that's me. And, but I can't be everywhere all the time. So if they recognize that there is some type of impact either to the head or to the body that caused that whiplash motion that Dr. Data had mentioned earlier today, they're to pull them out. And until they have some type of evaluation, they're not to go back in. So it's a heads up program. It's a certificate program all New York State Public High School Athletic Association coaches have to take every 2 years. The athletic trainers, school nurses are also involved with that, also take that concussion course, just so we're all on the same page as to what needs to be done when we recognize a head trauma.
Yeah. And what kind of sideline evaluations are done?
Well, as an athletic trainer, I'll get them to the sideline and I do what's called a SCAT-5 sideline assessment. And most of the time it's like the cranial nerves, the cervical nerves, checking for amnesia, asking them how they feel. There's a whole list of symptoms everywhere from physical symptoms to emotional symptoms, how they're feeling in terms of dizziness and headache to, are they feeling, are they having emotional reactions to this? And a lot of them will do because they're teenagers and they've just been removed from a game. But we have to look at, is it more than their normal? Are they more emotional? They're more reactive because of this. And it can be difficult to juggle because athletes are athletes and they want to stay in the game. After that, if I choose to continue, we can do things like concentration and memory and a balance exam. So that's all part of the SCAT-5 exam that we can do on the sideline after trauma.
Zach, Harry, if you can sort of piggyback on that about, being realistic and being responsible and the fear of being isolated also. I think both of you athletes have talked about that. If you're not going to be back in the game, you want to shed a little experience and expertise on that.
Go ahead, Zach.
Absolutely. So I think the one that you had touched on there is the isolation. That's certainly one that I felt maybe the most, is, you're kind of inside your own head, and Dr. Data mentioned this earlier. When things start getting to the point where everything reads normal, but you don't feel normal, that's very frustrating for you when you still have symptoms. And it's also frustrating for your trainers, for your coaching staff, for your teammates, frankly, who want you to come back. It makes it very difficult. Sometimes it feels like you're the one holding yourself back. Am I okay enough to return? And so these are sort of internal conversations you have with yourself that can be very, very challenging.
Mhm.
There is so much that I could say here. We probably would be here for a few hours. But athletes are trained to be on the field and to play and produce. And when you come together, let's say an offensive lineman, he is in a brotherhood with 5 or 4 other offensive linemen, and they're working in sync. And the one thing that you don't want to do is sustain an injury and not be able to contribute as part of that team that is so tight. And so, when players are on the field and they sustain a concussion, I'll be honest with you, some players will lie because they want to stay in the game. And they don't necessarily think about tomorrow or next week or 10, 15 years down the road. They think about what's happening at that moment, and they want to play, and they want to be a part of a team, and they want to be one of those guys to hoist the coach up and carry him off the field. But it's a difficult call for, I know, a lot of coaches and trainers who know these players personally, to have to pull them out. But it has to be what it has to be, and the health of the player is the most important thing. It's
And that
not
makes
about
everything that Amy was talking about, the work, the coaches training, the heads up, the sideline evaluations, all these things are critical, and everybody's got to be on page to do that. We've had 2 questions from the audience. Dr. Data, both are dealing with people who've had a number of concussions. And as they've gotten a little bit older now, one person said it worsened and that now they're disabled. Do you think the concussions played a role in that? And then there's the concurrent question that's going on is, what role do these concussions play in the development of dementia?
Yeah, that's a loaded couple of questions. So let's start with a global view, and we know there's long-term consequences, right, to repetitive head hits. Now, we only recently have been able to actually identify them in brain tissue in terms of cadavers, right? When someone passes away, we've been trying to get spinal fluid and get like biomarkers. There's only 2 biomarkers that have been identified by the FDA that can say, yes, this person has a concussion. But overall, we use a person's sustained symptoms to group them together and say, they have executive dysfunction, they have memory impairment, they have mood issues, they can have apathy, suicidality, poor impulse control, and a very extreme thing over time. Let's say these are very extreme cases that when you, at the time of their passing, look at their brain under a microscope, you can see that they have phosphorylated tau, like deposition of certain proteins in their brain that could say that they have CTE. No physician can give you a diagnosis of CTE. Let's just put it that way. because it's a pathological diagnosis. They can say, because of all the symptoms that you display and more, you may have developed CTE, but we cannot be sure until.
And I'm going to stop you right there because in case they didn't see the movie Concussion, CTE is what?
Right, exactly. So
Explain that if you would define that.
yeah, it's a sexy 3-letter word, but you can't throw that around. It's a very serious diagnosis. You can say that this is consistent with, but no one, unless you have X-ray vision, can give you a confirmed diagnosis of CTE. They can say on neuropsychological testing, which was just mentioned by Amy, neuropsychological testing is very, very advanced and looks at different domains of your memory, that you have dementia secondary to your many concussions, but you cannot say that you have CTE. So let's just make that clear. And the second thing is that cause and effect. If your memory decline and let's say your mood decline and everything is, as Harry said, he didn't make the connection, right? That certain things were happening like migraines or apathy or mood issues because of this, is a direct relation of you experiencing this, then we can say cause and effect. But who's to say, right? A lot of people have dementia in their family history. They're probably going to develop dementia at an earlier age, like in their 50s as opposed to 60s overall.
Everybody wants to, how do you protect? Because as somebody points out, you're not going to stop people from playing sports. So are helmets enough? I mean, what are some of the preventive measures that can be taken?
So I just want to put this out there that helmets do not protect you from concussions. Okay, they'll protect you from cracking your head open and having further injuries, but you can still get concussions with helmets. So that is number one. So I think, like you said, having these rules in place where there's no direct head-to-head sort of like hits allowed and certain things, direct checks, things like that. I think these are all in place to protect the players, and also I think baselining, Amy may have touched on this, but what we do for most players, we baseline them. This impact test that she's talking about, there is first set of tests done before the season even starts to see what their baseline is, so that we can see how it actually compares to what happens after they get injured, right? Baselining is very important for players. And also, I was smiling a little bit when we were talking about how some players lie, or Harry was saying some papers could lie. So we're getting smart too in the medical community. We're actually looking at things about how sandbaggable are these tests, right? So we are looking at all of that. We're trying to stay one step ahead of this whole thing. It's not like we're just, pocket protector wearing doctors. We're trying to see, kind of hang with you guys, the jocks, to see what you're actually doing to try to outsmart these tests. So it's at a very exciting time where not only is there recognition, but there's a lot of insight into the ways we can improve our testing and diagnosis as well.
Yeah. And you really do have to stay one step ahead. Everybody smiled when you said that, but it's key. I see Zach, he should have called you out, right, Zach?
Well, I think I was laughing too, because I was baseline. So my password is the 5 words I had to remember for my baseline testing. And so, baseline testing is really important, but it's also, still a work in progress, and you need people to break the system to make it better. So I was looking at that.
I'm going to run through a couple more questions here. Someone writes, they're living with 4 cognitively impaired TBIs, forgetfulness becoming more pronounced. Any suggestions on how to deal?
Yes, so there's a lot of advanced memory testing, as we discussed, the neuropsychological testing. I deal with these patients on a case-to-case basis. I do a lot of underlying testing, just, like basic dementia labs, like make sure that thyroid's in range. Almost everyone is vitamin D deficient in this country, So once you correct a lot of the underlying causes for memory loss, there is memory occupational therapy that we can send them to. We can send them to neuropsychology to work with them with memory cues and things of that nature. there are some supplements I start them on as well. Will you get back to your pre-morbid functioning? Absolutely not. We have to set expectations. We cannot expect that they will be back because their brain kind of has changed, unless it's in the acute phase already where I can do more, right?
Mhm.
But if it's been several years, we can even talk about starting them on medications that are used for dementia, but a little bit earlier, off-label, right? So there are certain things we can do. And even simple things like their lifestyle modification. We always say lifestyle, but having more of a Mediterranean diet, like fruits, vegetables. Is that going to bring back your memory 100%? No, but we know certain antioxidants helps better, not go with a steeper decline. We don't want the decline to be like this. We can kind of make it like even out as much as possible. So I can break the fall, but unfortunately I cannot wave a magic wand and bring you back to pre-morbid functioning, which is what I always tell my patients.
Yeah. Amy, you want to jump in?
No, I'm sorry, I didn't.
Okay, it's like, this is like
Not at
a
all.
motion here. If
Yeah.
I see your hand move, I'm calling on you and you're gonna make yeah, go ahead, Zach.
I was going to give maybe a more qualitative thing that really helped me is talking about it and finding community. So I volunteer for the Headway Foundation. It's a concussion advocacy nonprofit. And for me, that was very cathartic, being able to talk about my experience with others, find others who have had similar experiences. And we have a concussion circle where you can, you don't need to be an athlete. You can sign up, you can speak to someone who's been through that experience before and just connect. And I know that for people who have different types of symptoms, that can be really encouraging to know that maybe you're not the only one, and you can talk about different strategies that may have helped. So I'm a big fan of finding community and talking.
I'm so glad you said that, because the next question I was going to go to, someone asks, is what kind of supports are in both the community and medical area that can help individuals with school and family guidance and work guidance for those to get their life back after an injury, and Headway is one of them. How do you find that? Is that, obviously you can go to the Bianis, and we'll talk about those numbers and the website afterwards. But for Headway, are you out there? Are you easy to find?
Yes, absolutely. We have a website, headwayfoundation.com. We're also on social media, Headway FDN. But I was very lucky personally. They ended up doing a pilot program in their first year, was the year that right after I'd come back from a concussion, where they had athlete representatives from teams in my league. And I jumped up at that opportunity. And we're involved now with hundreds of youth teams, high school teams, and collegiate teams as well. So I think maybe for those who might not be interested in going directly headfirst into advocacy, certainly speaking about your experience with people who are close to you, whether they be friends or family or your physician or your trainer or coach, if those are people that you trust, is a great way to sort of open the door to maybe other opportunities or other ways to help yourself.
And again, as you point out, you're with others who understand.
Exactly.
And that's healing in itself. Somebody is asking, I've got a question here. What is the future? And I don't know what this is, so please help me out. The future of cerebellar cognitive affective syndrome.
So I think we're getting into territory of a lot of sort of newly kind of coined diagnosis. So basically the cerebellar system is responsible for your coordinating your movements mostly. So if you have imbalance after concussion, there's a couple of different reasons. One is your inner ear, your vestibular system. Number two could be the cerebellar system. So that's really what that means. And it's kind of out of the scope of a panel like this. So we can feel free to, have them have a consult, with me in the office. We can talk with them all this information later. But in a nutshell, it's just basically your balance can be off, and it can be off for a long period. But just keep in mind, like what concussion can do, it could unmask things that may have already perhaps going to happen to you, but it'll happen earlier. So let's say so the cerebellar or whatever, it may just be Parkinson's. You might have early onset Parkinson's. I have a lot of patients in their like late 40s and 50s that have diagnosed with early onset vascular Parkinson's as a result of the concussion.
Mhm.
Okay. You could have some other dementia kind of pop up earlier if you have family history. So you really need, someone who's trained in it and a team of multidisciplinary physicians as well as physical therapists, trainers, everyone to work together to help you.
And just to go back to something that Zach was talking about, Biani's also has support programs for families that have been impacted by traumatic brain injury, by concussion. There's another thing. Brain injuries are often, they're invisible. Once I see Harry's nodding and Zach having lived through it, because people look at you and they go, but you look fine. And I'm wondering, in terms of the recovery that you need, the challenges that can happen during that recovery, when people look at you and dismiss your injury, how does that play into the recovery and the concerns you have trying to get well, Harry?
Well, when you hurt your knee or ankle or hip or back or whatever, people can see that and they take you at your word that, you're in pain. Oftentimes when a player or an athlete sustains some kind of head trauma and they're not their complete self, unless somebody has been through that before, people really don't understand what you are as an athlete with a concussion is going through. And so there's no way that they can sort of comprehend, because if you're not like Amy or Dr. Dada, and you know exactly what they're going through, and also you, Zach, because you sustained a concussion. I have a son who's a doctor, and quite frankly, I steered him away from football, and he went into more about basketball, but he did play a little football in college, and he sustained a concussion. So when he became a doctor, he has a better understanding of what, people who are concussed are going through his own experiences. But people really don't understand exactly what you're going through unless they've been through it themselves. And, I would encourage, everybody, and this is not just athletes, because I've sort of been in this thing for a long time. I was diagnosed with post-concussion syndrome like 31 years ago. And I've met all kinds of people who have sustained all kinds of head trauma, equestrians who, riding the horse and they're jumping over barriers and everything, and they fall 99 times, and that 100th time they're affected by that fall. Many hockey players who have played and they're dealing with the residual effects of concussions that they may have sustained. You have cheerleaders who you may not count them as athletes, but when they throw you up in the air, and if they don't catch you, anything could happen. The cheerleaders are going to have all kinds of neurological issues as a result of what they're doing. So I think everybody should have a vested interest in, their kids and their grandkids and their great grandkids, playing sports, but playing it safely.
Yeah.
And this is the last thing that I'll say on this subject. I have a grandson who is 11. When he was 2 years old, I told my daughter he was not playing football, even though I played for 21 years. I'm sort of the bad person to deliver the news that, nope, you're not going to play football. And that's that. And he has resolve himself to understand that he's not playing football. There's only one way to eliminate concussions. And you know, doctor was speaking a second ago about you know, doing certain things to get back to your normal self, or you may not be able to get totally back to your normal self. For me, one concussion is one too many. And you know, I'm all about sports and everything, but I'm also all about you know, kids you know, not destroying or hurting themselves neurologically because they want to follow in somebody's footsteps, or they need to do something to get a scholarship to go to college or whatever. So, you know, I sort of look at this thing, you know, very interesting because, like I said, I know when I started playing football, I knew that I could get hurt physically. I knew I could hurt my knee, and because I saw them, you know, cart people off the field, and I thought, you know, you play football, that might happen to you. But I didn't know about the neurological issues that you are assuming, the risks that you are assuming as a part of playing the game. And I think, and I keep saying, parents really need to understand exactly what they're signing their kids up for. I'm not anti-football. If you learn about, you know, the injuries that you can sustain neurologically and how those injuries will stay with your child for the rest of their lives.
And that's so important. And, you know, one other thing, I'm watching the clock tick down here. You know, I'm assigned, you know, the timekeeper.
I know.
Amy, just one more thing to get in. That somebody wrote, as a school nurse wrote, that they work closely with teachers to make sure they provide accommodations for classwork that teachers don't always get. It goes back to that invisible injury. And I see Zach and Harry nodding in agreement.
Yeah, absolutely. It's something we've really worked in developing in a concussion management team at South Colony. And school districts across the state do it as well. And it's a team of administrators, teachers, guidance counselors, school psychologists as needed, the athletic trainer, and the school nurse. And I know we do seminars for the teachers so they can understand what it's like for the student, not only the student athlete, but students who have concussions. It's not just sports that creates concussions, accidents at home and things like that. So it's a full team that helps the student get the accommodations needed. It's the athletic trainer and the school nurse, the teacher and the guidance counselor, the team that's the medical team that's treating the students, and maybe even their general practitioner. Their family, of course, is involved in all this. So it's an entire team of people that are looking out, investing the best for the best interest of the student, whether it's a sport-related concussion or something else.
And Dr. Dad, I'm going to let you have the last word, but I'm going to make a comment. One of the participants wrote, brain injuries not only change you physically and mentally, but even your sense of self can be changed to the point where you don't recognize you. So be careful with your brain. It's very precious. So coming full circle, one concussion can be one too many, I think would be the answer, Dr. Dada.
Yes, I think I echo the sentiments of our esteemed panelists here to say that, yeah, one could be one too many. And this is why I'm generally, since I've trained in this realm, very risk averse, much to the dismay of my family that wants to do cool things on vacation. But it really is a precious thing, your brain and the rest of your life. You want to be as present as possible. And, you know, it can happen at any time. That doesn't mean that you live your life in fear, but if you know something has a cause and an effect, then, you know, the writing is on the wall. So that's basically what I want to say. And I also want to say that buyer beware, right? There are a lot of people sort of peddling or saying that they're concussion experts. And as normal consumers, you may not know who is good versus not. So going to organizations like the Brain Injury Association, they may keep, you know, names of people that physicians or practitioners that are vetted, right? That's better than just looking at a sexy website and going for craniosacral therapy or like IV infusions of vitamins.
Mhm.
So buyer beware, right? There's a lot
Yeah.
of people that jump on the bandwagon once something becomes very sexy. And I know Harry probably has seen this over his long career. And you need to really have a good understanding and a good training in this in order to understand all the nuances that come with treating these
Yeah.
very delicate patients.
Got to run. I'm looking at the clock. I want to say thank you very much for everybody taking part. This was presented by the Brain Injury Association of New York State's Concussion Initiative Committee. A recording will be available September 17th of this to coincide with and recognize National Concussion Awareness Day. For more info, visit the bianis.org or call 518-459-7911. Everybody was wonderful. Thank you all so very much for sharing your time and your expertise. Everybody be well. Take care. Take care.